After acquiring the requested X-rays, a critique can be conducted on the images to assess the SI joint status. Diagnosis of potential pathologies from the patient's symptoms, guided by the radiographs, could include ankylosing spondylitis, psoriatic spondylitis, and osteoarthritis. As aforementioned, ankylosing spondylitis is a common arthritis. It is caused by mutation of the leukocyte antigen B29, and clinical manifestations include chronic back pain, spinal rigidity and stiffness, limited spinal motion and chest expansion, and inflammation of the peripheral joints, phalanges, shoulders, and pelvis. On radiographs, ankylosing spondylitis is characterized by bony spurs called syndesmophytes that can cause bridging of the intervertebral discs leading to ankylosis, degenerative bony spurs, bilateral and symmetrical sacroiliitis, osteitis, erosion of subchondral bone that appears as joint winding, reactive sclerosis, and a loss in definition of articular surfaces that is accompanied by osteoporosis. In the later stages of ankylosing spondylitis, joint space is completely lost as new bone formation seals the open joint space caused by erosion. Like ankylosing spondylitis, psoriatic spondylitis, and osteoarthritis are forms of arthritis that can exhibit similar symptoms and abnormalities on X-rays. Psoriatic spondylitis is a type of erosive arthritis, an autoimmune disease that is also caused by the mutation of the leukocyte antigen B29, leading to inflammation of the spine causing movement problems and joint pain. Symptoms include back pain, pain and swelling in other joints including hips, dactylitis, sausage-like swelling of the toes and fingers, reduced ROM of the lower back, spine and pelvis, psoriasis, an autoimmune disorder that causes healthy skin cells to turn over at an abnormally fast rate, or nail lesions, and chronic fatigue. On radiographs, psoriatic spondylitis is characterized by bony erosions and resorption appearing as the pencil in-cup deformity, bony spurs, new bone formation or periostitis, layers of periosteal ossification due to diaphyseal inflammation, joint space narrowing, and asymmetrical spinal and interphalangeal joint involvement. In psoriatic spondylitis, healthy joints are attacked by the immune system from a skin disease which results in arthritis. Hence, in addition to reduced ROM and pain, there should be a presence of psoriatic skin or nail lesions which differentiate psoriatic spondylitis from ankylosing spondylitis. On the other hand, osteoarthritis is an inflammatory disorder where there is a loss of joint cartilage and reactive new bone formation. It mainly affects weight-bearing joints and IP joints of fingers, in our patient's case, the hip joints. Osteoarthritis also causes the joints to become stiff and painful, thus reducing range of motion. Symptoms include back pain, stiffness, swelling, tenderness, grating or crackling sound during movement, and limited range. Radiographic features include narrowing joint space, slipping of joint margin, sclerosis, bony cysts, and osteophytes.
Created using Powtoon.